Welcome to Lesson 10 of the KS Medical Coding Academy EM training series. This is part 2 of our office and other outpatient evaluation and management coding lessons. In the previous lesson, we learned how to select EM service levels using medical decision-making and total time. In this lesson, we will continue by exploring EM prolonged services, including prolonged service codes for Medicare and non-Medicare patients, advanced care planning, telephone and digital EM services, preventive counseling, nursing facility services, hospital discharge management, and important CPC exam tips. By the end of this lesson, you will have a clear understanding of how to correctly report these time-based EM services. Let's begin. Before we begin, this training is for educational purposes only. Always refer to the latest CPT, ICD-10CM, HCPCS Level 2 manuals, payer policies, and official coding guidelines when assigning medical codes. Now let's review the time-based coding chart for new patient office or other outpatient EM services. The chart compares Medicare on the left with other than Medicare on the right. The coding for 99,202 through 99,204 is the same for both payer types. If the physician or qualified healthcare professional spends 1 to 14 minutes, the visit should not be selected using time. Instead, choose the code based on medical decision-making, or MDM. When the total time is 15 to 29 minutes, report 99,202. For 30 to 44 minutes, report 99,203. For 45 to 59 minutes, report 99,204. The difference begins with 99,205. Under Medicare, code 99205 covers 60 to 88 minutes. If the total time exceeds 88 minutes, report HCPCS code G2212 for each additional 15-minute increment. For other than Medicare, code 99205 covers 60 to 74 minutes. Once the time exceeds 74 minutes, report Captain add-on code 99417 for every additional 15 minutes. Always remember that G2212 is used for Medicare, while 99,417 is generally used for commercial or other non-Medicare payers. Before reporting prolonged service codes, verify the patient's insurance because payer rules may vary. Finally, document the total physician or qualified healthcare professional time on the date of the encounter, as accurate documentation is required to support time-based code selection. Now let's review the time-based coding chart for established patient office or outpatient EM services. The first code in this category is 99,211. This code does not have an assigned time, so the table shows not applicable or NA. If the total physician or qualified healthcare professional time is 1 to 9 minutes, the visit should not be selected using time. Instead, choose the level based on medical decision-making, or MDM. When the total time is 10 to 19 minutes, report 99,212. For 20 to 29 minutes, report 99,213. For 30 to 39 minutes, report 99,214. The highest established patient office visit code is 99,215. Here, Medicare and non-Medicare rules are different. For Medicare, 99,215 covers 40 to 68 minutes. If the physician spends more than 68 minutes, report HCPCS add-on code G2212 for each additional 15-minute increment. For other than Medicare, 99,215 covers 40 to 54 minutes. When the total time exceeds 54 minutes, report Captain add-on code 99417 for every additional 15 minutes. Always remember that Medicare uses G2212, while commercial and other non-Medicare payers generally use 99,417. Before assigning prolonged service codes, verify the patient's insurance plan and follow the applicable payer guidelines. Finally, ensure that the total physician or qualified healthcare professional time on the date of the encounter is clearly documented, because accurate documentation is required to support time-based code selection. In this slide, we will review the time-based coding table for initial hospital observation or inpatient evaluation and management services. When selecting the EM level, you can use either medical decision-making, or MDM, or total physician or qualified healthcare professional time on the date of the encounter. For Medicare, if the total time is 1 to 39 minutes, the code should be selected based on MDM. Time-based coding begins with 99,221 for 40 to 54 minutes, 99,222 for 55 to 74 minutes, and 99,223 for 75 to 89 minutes. If the total time exceeds the maximum time for 99,223, report the prolonged service code G0316 for each additional 15-minute increment. For payers other than Medicare, the initial hospital codes remain the same, but the prolonged service code is 99,418 instead of G0316. Remember, prolonged service codes are used only when time is the basis for code selection, and the total time must be documented on the date of the encounter. Exam tip: always verify whether the payer is Medicare or non-Medicare, because the prolonged service code changes from G0316 to 99,418, even though the primary EM codes remain the same. In this slide, we'll review the time-based coding table for subsequent hospital observation or inpatient evaluation and management services. These services can be selected using either medical decision-making, or MDM, or the total physician or qualified healthcare professional time spent on the date of the encounter. For Medicare, if the total time is 1 to 24 minutes, the code is selected based on MDM. Time-based coding starts with 99,231 for 25 to 34 minutes, 99,232 for 35 to 49 minutes, and 99,233 for 50 to 64 minutes. When the total time exceeds the maximum time for 99,233, report the Medicare prolonged service code G0316 for each additional 15-minute increment. For example, 65 to 79 minutes is reported with 99,233 plus G0316. For payers other than Medicare, the primary EM codes remain the same, but the prolonged service code changes to 99,418 instead of G0316. Remember, prolonged service codes are reported only when time is used to select the EM level and the total time is documented on the date of the encounter. Exam tip: for subsequent hospital visits, remember the key thresholds. 99,231 begins at 25 minutes, 99,232 at 35 minutes, 99,233 at 50 minutes, and prolonged services begin after 64 minutes using G0316 for Medicare or 99,418 for non-Medicare. This slide explains the time-based coding for hospital observation or inpatient discharge services. There are only two captain codes used for discharge day management. Report 99,238 when the physician or qualified healthcare professional spends 30 minutes or less on the discharge day. Report 99,239 when the total discharge management time is more than 30 minutes. The reported time includes all discharge-related work performed on the date of discharge. This may include the final patient evaluation, reviewing the hospital stay, preparing discharge records, writing prescriptions, providing discharge instructions, coordinating follow-up care, and communicating with the patient, family, or other healthcare providers. Accurate documentation of the total time spent is essential to support the selected code. Exam tip: remember the simple rule, 99,238 equals 30 minutes or less, while 99,239 is used for more than 30 minutes. These codes are based on total discharge day management time, not medical decision-making. In this slide, we'll review the time-based coding guidelines for initial nursing facility care. The level of service may be selected using either medical decision-making, or MDM, or the total physician or qualified healthcare professional time spent on the date of the encounter. For Medicare, if the total time is 1 to 24 minutes, select the code based on MDM. Time-based coding begins with 99,304 for 25 to 34 minutes, 99,305 for 35 to 49 minutes, and 99,306 for 50 to 64 minutes. When the total time exceeds the maximum time for 99,306, Medicare allows reporting prolonged service code G0317 for each additional 15-minute increment. The first prolonged service is reported after the required time threshold has been met. For payers other than Medicare, the primary nursing facility codes remain 99,304, 99,305, and 99,306, but the prolonged service code changes to 99,418 instead of G0317. Remember that prolonged service codes are reported only when time is used as the basis for code selection, and the total time must be documented in the medical record on the date of the encounter. Exam tip: remember these key time ranges. 99,304 equals 25 to 34 minutes, 99,305 equals 35 to 49 minutes, and 99,306 equals 50 to 64 minutes. For prolonged services, use G0317 for Medicare and 99,418 for non-Medicare when the required time threshold is exceeded. In this slide, we review the time-based coding guidelines for subsequent nursing facility care. When the provider spends less than the minimum required time, code selection is based on medical decision-making, or MDM. For Medicare, Captain codes 99,307 through 99,310 are selected according to the total time spent on the date of the encounter. If the provider's time exceeds the highest level service, report HCPCS code G0317 for each additional 15-minute increment. For non-Medicare payers, the same EM codes are used, but prolonged services are reported with Captain code 99418 instead of G0317. Always remember that total time must be documented on the date of the encounter, and prolonged service codes are reported only when time, not MDM, is used to select the EM level. CPC Exam Tip. Medicare uses G0317, while most other payers use 99,418 for prolonged nursing facility services. Let's review the time-based coding for nursing facility care, patient discharge. There are two Captain codes used for discharge management. CPT code 99315 is reported when the total physician or qualified healthcare professional time spent on the discharge day is 1 to 30 minutes. CPT code 99316 is reported when the total discharge management time is more than 30 minutes. The reported time includes activities such as the final patient evaluation, discharge planning, medication review, preparation of discharge instructions, coordination of follow-up care, and completion of the discharge documentation. All of these activities must occur on the date of discharge. CPC Exam Tip. Remember the simple rule: 99,315 equals 30 minutes or less, and 99,316 equals more than 30 minutes. Always document the total discharge time in the medical record to support code selection. In this slide, we'll review time-based coding for home or residence established patient EM services. When the total physician or qualified healthcare professional time is below the minimum required time, select the EM level based on medical decision-making, or MDM. For Medicare, report Captain codes 99,347 through 99,350 according to the total time spent on the date of the encounter. If the provider spends time beyond the highest service level, report HCPCS code G0318 for each additional 15-minute increment. For non-Medicare payers, the same EM codes are used, but prolonged services are reported with Captain code 99417 instead of G0318. CPC Exam Tip. Remember this rule: Medicare uses G0318, while other payers use 99,417 for prolonged home or residence visits. Always document the total encounter time when selecting the EM level based on time. In this slide, we'll discuss counseling and risk factor reduction intervention codes. These Captain codes are used when the provider spends time counseling patients or groups about reducing health risks, such as smoking cessation, nutrition, weight management, or disease prevention. For individual counseling, use CPT 99401 through 99404 based on the total face-to-face counseling time. Services lasting 7 minutes or less are not separately reportable. For group counseling, use CPT 99411 for 16 to 45 minutes and CPT 99412 for 46 minutes or more. Group counseling of 15 minutes or less is not separately reported. CPC Exam Tip. These codes are time-based and require documentation of the total counseling time, the topic discussed, and that the counseling service is separately identifiable. Always follow payer guidelines when reporting preventive counseling services. Let's discuss Advanced Care Planning, or ACP. These services help patients and families make informed decisions about future medical care if the patient is unable to communicate their wishes later. Coding is based on the total time spent in discussion on the date of the encounter. If the discussion lasts 15 minutes or less, do not report an ACP code. Report CPT 99497 for the first 16 to 45 minutes, and add CPT 99498 for each additional 30 minutes of discussion. Always document the total time, participants involved, and the topics discussed in the medical record. Proper documentation is essential for accurate coding and reimbursement. Let's review telephone calls and digital EM services. These are non-face-to-face evaluation and management services that are selected based on the total time spent. For telephone EM services, do not report the service if the total time is less than 5 minutes. Report 99,441 for 5 to 10 minutes, 99,442 for 11 to 20 minutes, and 99,443 for 21 to 30 minutes. For digital EM services, such as secure patient portal communications, do not report services lasting less than 5 minutes. Report 99,421 for 5 to 10 minutes, 99,422 for 11 to 20 minutes, and 99,423 for 21 to 30 minutes. Always document the total time, the clinical discussion, and ensure these services meet payer-specific reporting guidelines. Let's apply what we've learned with this knowledge check. In this scenario, a new patient with non-Medicare insurance is evaluated in an orthopedic office for right knee pain. The physician reviews a previous X-ray, orders an MRI, and develops a treatment plan. The X-ray taken today will be billed separately, so the time spent performing and interpreting that separately reported service is not included in the EM time calculation. The physician's documented time for the EM service is 40 minutes. For a non-Medicare new office patient, a total time of 30 to 44 minutes corresponds to Captain Code 99203. Therefore, the correct answer is 99,203. Always remember to exclude time spent on separately reportable services when selecting a time-based EM code. Let's work through another knowledge check. In this example, the patient has Medicare and returns for an established office follow-up visit for type 2 diabetes. During the encounter, the physician reviews recent glucose readings, discusses treatment options, recommends starting metformin, answers the patient's questions, reviews records, places orders, and completes documentation. The total physician time for the encounter is 70 minutes. Since this is an established office visit for a Medicare patient, we first identify the primary EM code as 99,215. Because the documented time exceeds the Medicare prolonged service threshold, we also report G2212 for prolonged office or outpatient services. Therefore, the correct coding is 99,215 plus G2212. Always verify the payer, total documented time, and prolonged service rules before assigning additional codes. Congratulations on completing this lesson on EM time-based coding and prolonged services. Throughout this training, we learned how to select evaluation and management codes using total physician or qualified healthcare professional time, identify which activities count toward time, recognize activities that should not be included, and correctly report prolonged services for both Medicare and non-Medicare patients. We also practiced applying these concepts through coding scenarios and knowledge checks. Remember, accurate documentation is the foundation of correct coding, compliance, and proper reimbursement. Continue reviewing the Captain guidelines and practice coding regularly to strengthen your CPC exam preparation. Thank you for learning with KS Medical Coding Academy. I wish you continued success in your medical coding career. See you in the next lesson.